Okay, so I decided maybe we should do one more diagnosis together. So I chose heart failure. It is also known as congestive heart failure. Um, Heart failure is the most correct terminology, but you will frequently hear it referred to as CHF, congested heart failure. But it is a chronic heart condition where the heart doesn't pump blood effectively anymore. And the structures of the heart actually change. They can remodel to where they either become stiff and hard, or they can remodel to where they're just kind of boggy, I guess is the best word to describe it, where they no longer stretch and come back and contract effectively. So if the right side of the heart isn't pumping correctly, and remember the right side of your heart pumps blood over to the lungs, where it's going to pick up that new oxygen supply to bring back to the left side of the heart so it can pump it to the body. If your right side of the heart isn't pumping correctly because it has remodeled, it's not going to pump blood correctly over to the lungs. And so what will happen is fluid tends to back up, and where it's going to back up to is from the body, because remember, blood's coming from the body through the superior and inferior vena cava into the right side of the heart. So blood tends to back up into the body. So you see edema, you see swelling of all the tissues. Now, if the left side of the heart is affected, where the left side of the heart isn't pumping correctly, then if things are pumping out from the left side of the heart to the body, then things are going to back up, and they're going to back up into the lungs. So people get fluid building up in their lungs, and they get very short of breath and have a hard time oxygenating correctly. So common signs and symptoms that we see with heart failure is shortness of breath. Okay, especially if you have left-sided failure where things are building back up into your lungs, fluids building up, people get very, very short of breath. Fatigue. For right and left-sided heart failure, people get very tired. The exertion is really tiring for them, and so they will definitely need periods of rest. Edema, that swelling of the tissue, we tend to see that in the lower extremities especially, or if you have someone who's laying down all the time because they have immobility, you'll see that swelling happen in that sacral area. Rapid or irregular heartbeats are very common with heart failure. Chest pain, lightheadedness, dizziness is really common, and a frequent cough can be seen as well. Now, and I should have mentioned when I talked about right-sided heart failure and left-sided heart failure, some people will have both. Both sides of the heart will go out at the same time. So what are risk factors for heart failure? Age. As we get older, the heart doesn't work quite as effectively. There has been a link with heredity. So if you have family history of heart failure, you might be more prone to it. Smoking, smokers, and it's not just smoking, it's tobacco use in general. So even if you chew tobacco or secondhand smoke, smoking products and stuff tend to be a big risk factor for this. Hypertension, HTN is our abbreviation for hypertension, high blood pressure. And remember, high blood pressure is blood pressure that is consistently over 130 systolic or over 80 diastolic. And that does put a strain on the heart. It makes the heart pump against more resistance, and it can actually start damaging the heart muscle over a period of time. Obesity, being overweight and being obese. Heart attacks, people that have had heart attacks where the heart muscle, where part of the heart muscle hasn't gotten blood and oxygen, and part of that heart muscle dies, it's in that area a lot of times that it starts to remodel and then become what we see with heart failure patients. And diabetes can also put you at risk for this. So the complication of not being treated, well, there's a lot of complications, and they're all going to lead to death. So if the person's having irregular heartbeats and we're not doing anything about it, that can potentially lead to death. If the person's lightheaded, dizzy, they're not oxygenating well, they're short of breath all the time, they're not getting enough oxygen, and we don't take care of it, obviously they can die. So death is a big complication, obviously. Now, basic nursing care, things we really need to think about when we're caring for that resident with heart failure. And there's a lot of them, and I put some of the more common ones here. But because that person has issues with shortness of breath, so if you think about this, if the person gets fatigued easy and they get short of breath easy, we are probably going to need to do our care in smaller increments. We're going to need to allow them periods of rest in between those activity of daily living. They may also be on oxygen therapy if they get really short of breath, and especially if they have right-sided failure. Well, actually, you can see it with right-sided failure because blood's not getting over to the lungs to oxygenate. You see it with left-sided failure because fluid's backing up into the lungs, so oxygenation is going to be impacted. So you can have shortness of breath with right or left-sided failure. But if they're not oxygenating well and they're getting tired really easy, there's a good chance they're on oxygen therapy. So when we do vital signs, and vital signs are going to be really important to do on a regular basis for this person, we should also be checking oxygen saturation values. And when we're taking care of a person as a CNA that is on oxygen, we always need to know, how many liters per minute should that person be on so we can make sure nothing's gotten turned the wrong way. And is the oxygen PRN, meaning they can use it as needed, or is it something they're supposed to have on all the time? And we have to realize that or know that when we're giving that care so we know best how to care for them. If you have a person who is on oxygen all the time, we're going to need to make sure that if they do get out of bed or they do get an opportunity to actually use the bathroom instead of having to use a bedpan, that we put them on a portable oxygen tank to be able to do that. And again, remember with oxygen, we are not allowed to dial in oxygen flow. Okay, it is considered a medication, so the nurse would need to do that. If the resident smokes, we would need to make sure that they receive some smoking cessation information, really encourage them not to smoke, especially if they're on oxygen. They're not going to be allowed to smoke, obviously. And most of the nursing homes nowadays are no smoking facilities. But even if it is a facility that allows smoking, we need to make sure that if they're on oxygen, they're having difficulty breathing, that they know how critical this is, that they don't smoke at this time, and hopefully that they learn how to potentially give it up, how long-term of an issue this is going to be for them. When a person has heart failure, this is going to be a chronic disabling condition for them. This isn't something, we've got medication that can help strengthen and tone the heart muscle. We have medication that can help people get rid of that extra fluid. We can provide oxygen if they're not oxygenating well, but it's going to be a chronic condition that they're going to have at this point that they're going to have to take care of. So it's something that it's going to be really critical that they understand this and the importance of that not smoking from now on. We want to keep the heart as toned as possible, but we need to balance that with those periods of rest due to fatigue. So we do want them to still exercise, but they need to have a period of rest, and then we would exercise them, and then we would let them go back to a period of rest. We would also need to know if they're on oxygen, if they can exercise without it, or if they need to be on it again at all times. Now, since residents with heart failure have issues with extra fluid backing up into their lungs or into their body, they are usually going to be on daily weights. Most people that have heart failure are on daily weights, and it's something that even when they go home, we teach them to do daily weights. If they gain more than 2 pounds in a day, they need to call their doctor, because if they're starting to retain too much fluid, they're going to get into trouble really quickly. 4 or 5 pounds extra fluid in the lungs, it's going to make somebody so short of breath they're not going to really be able to breathe adequately. So it's really important that we do daily weights in the facility and that we teach them to do daily weights for when they go home. And when we do daily weights, remember, we try to weigh someone at the same time of the day. So usually it's the first thing in the morning before they've eaten, same level of clothing on. And we can really have a good comparison to see if they're starting to retain too much fluid. They're usually also put on a low sodium diet because salt does tend to make people retain extra fluid. And then it's very, very common for these people to have fluid restrictions ordered. Their heart is just not working as effectively, and when you have too much fluid in your system, it's putting an extra strain on your heart, because your heart's got to pump all that extra fluid around the body. And you have to remember the heart's not pumping correctly, which is why we're in this issue. So it's a really double-edged sword there. And so usually with heart failure patients, you will see fluid restrictions being ordered for them. The other thing we like to do is if the person is overweight, we want to encourage them to go on a low-calorie diet. Cut back on sweets if they're diabetic, but start looking at their diet, of what they're eating, because again, they're going to need good protein sources to keep their energy up, but we don't need, the extra weight is just one more thing that's putting a strain on that heart at this point. So my nursing care plan, I told you I wanted you to come up with 2 nursing diagnoses, which is a nursing problem, something that nursing in general can take care of. Then we have a goal for each of those problems, and the goal needs to be measurable and dated when we think it can that we could take care of it by, and then at least 3 interventions for this problem. Now, there's a lot of potential problems with heart failure. The list goes on and on and on, and some of them are kind of complicated issues more than what we really need to get into for this class, but a lot of them are really simple things that we can do to make this better for a person. Now, remember, it is the RN's responsibility to develop this plan of care. But as the CNA, we are going to really be helping with the interventions, with the implementation of this plan. And I think, and one of the reasons I give you this activity that I want you to start looking at the plan of care, even though that's not your normal job, if you understand the problems that a person has, if you understand, gee, I have this diagnosis, this is probably what's going to be going on with them. These are things I need to be thinking about for my residents. Okay. So one of the problems I put was activity intolerance. I mean, remember, this person is fatigued. Okay, they're getting fatigued and short of breath easy. So activity intolerance. So I put as the goal that they might be able to do desired activities and do their own activities of daily living by whatever time frame I think is practical. Now, generally with heart failure, if you're restricting their fluids, giving them the medications that are ordered, providing oxygen, this may be something we may be able to accomplish within a week even, okay, depending on what kind of shape they're in when we do that, when the nurse does that assessment. So interventions, again, we're going to provide rest in between activities. We're going to assess vital signs and oxygenation before activities to make sure they're oxygenating okay before we start stressing them even more. And we're going to assist with range of motion and ambulation. We're going to be helping them with these things until they're strong enough to be able to do them on their own. And as far as other activity, daily living, again, we'll always encourage them to do what they're capable of doing themselves, and we will do the parts that when they get too tired, too fatigued. Another really common problem, a common thing that we see with heart failure patients is deficient knowledge of this disease process. Because heart failure, there's over 200,000 cases in the United States of heart failure in the hospital, usually at all times. It's one of the most common diagnoses we see in a hospital setting, and it's a very common re-diagnosis, meaning patients get it, we get them better, we send them home, and a few days later they're right back in the hospital again because they don't have that good knowledge base. So it's really important that we educate our patients. We educate them what we're doing and why we're doing things. Now, again, I know this is probably more the LVN and RN's position, but when you're teaching them, ways to manage their stress levels, so, we could teach them why it's so important that they decrease their stress levels. When we teach them the importance, when we provide them that low sodium diet and we're giving them fluid restrictions, we let them know, they're on a low sodium diet and they're on fluid restrictions because it's hard for the heart to have extra fluid. And by doing low sodium, it keeps you from retaining extra fluid in the body, which makes it easier on the heart. We can teach patients how to look at food labels, to look at how much sodium is in an item. And when we're doing daily weights, if we have to do daily weights on this patient, we can explain why it's so important that they start getting weighed every day, and that even when they go home, this is going to be important. And if they notice a change of more than 2 pounds in a day over their weight, or it's usually more than 2 in a day or 5 in a week, that they call their doctor. We want to encourage them to stop smoking and give them smoking cessation material and teach them different ways, again, to decrease stress levels, whether that's meditation or yoga. And those are things we can help with as a CNA. Excess fluid in the body, that is another big problem, okay, with these patients. So I put as my goal, keep resident at a stable weight to decrease edema, that's swelling, by whatever time frame I think. Usually a lot of this can be done within a week or so. Our deficient knowledge, we might be able to accomplish that goal within 3 days potentially, depending on, how well the person's grasping everything. So Our excess fluid, my goal is to keep the resident at a stable weight to decrease edema by, let's say, 1 week. I'm going to monitor daily weights, same time of the day, same amount of clothing when I weigh them. Record accurate intake and outputs. So we've learned how to do intake and outputs, and it's important for these patients that we're recording what comes in and what goes out, so we can make sure, if anything, we want to see that the fluid output is more than the intake. Most of these residents will be on medications they're called diuretics, to make them pee off extra fluid out of their body. So if we're seeing that intake is a lot more than output, there's something wrong. Okay, there's something seriously wrong. And so we need to be tracking this and making sure that we let the nurse know if intake and output doesn't seem right to us. So we assess the extremities for edema, swelling of the tissue or edema. You'll tend to see it in the ankles and the lower extremities more than you do the upper extremities. If you have that resident that doesn't get out of bed much, you might see it in the sacral area if they're laying down all the time. But usually we see it in the lower legs, in the ankles and the lower legs, and they puff up, they're really swollen. And you stick your finger in it and your finger kind of indents in the shape of it. So we want to assess the extremities for edema or swelling, and the nurse or the LVN would provide diuretics as ordered. We would observe for any shortness of breath. And again, we don't control oxygen flow, but we do help manage patients with oxygen. We do make sure that we're checking, those pressure areas that we talked about on the cheeks and the top of the ears and right under the nose. We look for signs of hypoxia that we've talked about, where their heart rate's fast, the breathing's fast, their color is starting to look cyanotic, where it's starting to turn a little bit blue. The nail beds may start looking blue. They look short of breath. They look like they're taking in accessory muscles. We want to pay attention to that and make sure that we get the nurse if we're noticing anything like that. And the other thing we'll do, of course, is that low sodium diet and the fluid restrictions that also will help with the excess fluid volume. So I thought maybe it might help to just go over a second care plan before I let you try this on your own.